Good morning. If you are a male in your 50s and 60s, that means you are young and you have got urinary complaints of prostatism or LUTs in which the urinary flow is not good, which is ascribed by your urologist or your family practitioners or by urologists like us that you have got an obstruction to the flow of urine because the prostate is occluding the urinary passage, which is a basic reason why a prostate gradually occludes a narrow urinary passage and causes those progressive urinary complaints of obstruction, then this discussion is for you. So, friends, men in their 50s and 60s will find obstruction to the flow of urine, for which traditionally we treat patients with medical management and prevent the progression of issues by letting the prostate not occlude the urinary passage completely one fine day. The progression of this is without your permission and without your knowledge. It's a slow progressive change internally in your body. Prostate is deep under the bladder at the level of bladder neck, where it controls the urinary flow through a very narrow passage. As narrow passage as you can see is the one which goes and completely troubles the urinary passage. So that's the urinary passage, the black one. And the surrounding is the prostate. So the prostate is a male gland which actually progressively in your late 40s, 50s attempts to grow with changes in hormone. Its growth is visible to you and your sonologist on the ultrasound, but the growth is an external measurement of the prostate. The internal happening of the prostate is it controls that narrow urinary passage through which a man passes urine, and this sometimes undergoes a change very slowly. It doesn't happen over a day, week, month, or years or decades. Now, in today's era, if you are in your 50s and 60s, if you have issues with the urinary flow, which is taking time to empty your urine, taking time to start urine, you have to force and strain to pass urine, and the flow is getting narrower. It was already very narrow and it's getting narrower. You don't empty your bladder completely and sometimes pass in drops. All this makes your bladder super overactive in terms of trying to contract and empty urine, lest it will get blocked. If that is a progressive change, you can surmise yourself when you go to a public washroom, when people complete urination and you're still passing urine, it's time to wake up. It's time to wake up to a minimally invasive surgical treatment called MIST that's available in our country at the Kokilaben Ambani Hospital. I'm Dr. Sanjay Pandey, heading the Department of Urology, and keen to bring this to your notice that the information and awareness is missing in public domain. The information about taking you forward logically to treat you and cure you is a lot missing in public domain. Sadly, many of us go to our family doctors, take medications, attempt to get treated, but the results may not always be coming. So we are intending a cure. We're looking at how can we keep you over decades as good as you are today, because you may not be as good today. You may be on medical management and the results are not coming. Your flow is progressively going down. You only do a health checkup once a year, and you go to washroom or public toilets when you get down at the air stops and the bus stations, and you find that people have finished urination and you're still taking time to urinate. So friends, I'm talking about MIST. I'm talking about prostate urethral lift so that the occlusion of the urinary passage is removed. So let me in few minutes detail you about this new therapy, which was always there in the United States of America, which came to India a few years ago at the Kokilaben Hospital. I'm happy to relieve people of their catheter who are living on catheter and not able to pass urine because they are either at a very high risk of surgery and cannot undergo a surgery. The surgery that we traditionally do called the HoLEP surgery, the TURP surgery, where we used to carve open and remove the entire prostate. So for individuals who are young in the 50s, 60s, who are anxious about their sexual function to be maintained, who look forward to their ejaculation to be maintained, who have got a prostate which can actually be clipped or stapled out of the obstruction, the answer for you is prostate urethral lift. So right indication, right approach to a right individual, because for some we give medicines, for some we counsel and watch and wait, even if the prostate is enlarged. For some we closely observe because their medical management is not working, and people seek me from different parts of the country and different parts of the city, looking at early treatment, rapid treatment, durable treatment, which could last a lifetime, and obviously a follow-up. So friends, prostate may not stop growing just because you and I talk today, or just because you and I meet. Prostate will continue to grow. Prostate has a tendency to grow because of hormone changes around. On one direction, I treat prostates which are enlarging, obstructing the urinary passage with counseling on this sessions that I do on this channel. I look at a uroflowmetry, treat them medically, failing which we treat them surgically with a TURP and a HoLEP. On the other side, there are those patients whose prostatic enlargement also comes with a cancer prostate, for whom we look at the hormone therapy, look at radical robotic prostatectomy like the one we are doing today afternoon for a doctor, and we take it forward to the next level. So friends, minimally invasive surgical treatment is no surgery. It's all about minimally invading your urinary passage, assessing your passage, and then doing a prostate urethral lift. That means we actually take the prostate away from the occlusion that it is creating gradually, which is not visible on your sonography, which progressively is also not visible to you because over the months and years, the flow is gradually going down. Unless there has been a proper measurement of a uroflowmetry, you may miss it out. So extremely important for you to understand that what is there today will not be there tomorrow. And if you always continue to do what you're doing, you'll always get what you're getting, probably a progression of obstruction, which is not improving you. So today, prostate urethral lift, which comes by the name Urolift, has succeeded in patients whose catheters were not coming out. That means the urinary catheter was there was a bladder outflow obstruction proven on urodynamics, the prostates were moderately enlarged, and there was no attempt of surgery being done on them, partly because they were very high risk for anesthesia. They may be elderly people in their 70s, 80s. They may be very youngsters in their 50s and 60s. So we're looking at individuals who are young, who are progressing on their urinary aspects from where the flow is not getting better. The flow is only going bad to us. We need to improve them by taking a course where we can actually take the prostate away from the urethra, and that is called as Urolift. So out here, this prostate can actually be clipped away and can be clipped away so that this passage continues to stay wide. What it was in your younger days in 10s to 40s, where you could pass urine onto the wall with the speed that you wanted and could paint on the wall. That flow is gradually going down. So it's an awareness call, it's a wake-up call. For individuals whose flow is progressively going down, who see that it is going to come tomorrow because their fathers and grandfathers are undergoing surgery by me called TURP, to maintain their ejaculatory function, to maintain their erectile function, nothing happens wrong to them, to not have any urethral complications, and to have a good flow that can be maintained well with the prostate being kept away from the midline which it occludes, which is the urethra, and take it forward to the next level. We have succeeded on this attempt, which was not available to us in the last 16 years at the Kokilaben Hospital. Now we're happy about it. Over the last year that we have been starting doing for the right individuals, we're happy to give you minimally invasive surgical treatment by Urolift and taking you forward on a journey where you continue to pass urine as good as you were. We monitor your prostates and keep looking at there should be no situation where things can go wrong. So on one side, all youngsters in their 50s and 60s who want to maintain their sexual and ejaculatory function, who want to maintain a good flow, whose prostate is enlarging and causing occlusion, which is measured best by a uroflowmetry. Your urologist and your colleagues are attempting to treat you medically, which is probably the way of life in the last 50 years, where progression in the last 20 years in medical management has gone higher only because of the kind of medicines that has come up. So I think it is important for us to look at a kind of a therapy which could prolong everything for the next 20 years. We could watch you very closely, much closer, not let your prostate grow in size. At the same time, keep it away from the urethra. Don't occlude me, don't block my urinary passage, don't hurt my sexual function, and let me be as young as I have always been. So friends, prostate urethral lift called the Urolift at the Kokilaben Hospital Department of Urology waits for you. If you have a complaint of that kind where you are young in your 50s, 60s, you want a relief in urinary flow which has not happened with the medication that we choose best. Majority of patients have actually improved on medication. Those who have not done, they continue to wait and the progression of prostatic issues happen is not the way we would handle 2024 and beyond. So awareness, awareness, awareness. We need to have a motivation to get ourselves treated and cured, and we take it forward to the highest possible level in the Department of Urology at the Kokilaben Hospital. I, Dr. Sanjay Pandey, sign off for today, and we'll catch up again on this very exciting treatment, which a lot of people are thankful about. Blessings from them that we continue to do this good job again and again. Thank you so much.